Hi, my name is Pisana Ferrari, and in this pep talk, I'm going to be talking to you about how to write a business plan in 3 easy steps. I'll start by introducing myself. I'm a former pulmonary arterial hypertension patient. I was diagnosed in 1988, so very long time ago when there were no treatments or even surgery was just starting. So the disease progressed, and I had a double-lung transplant 23 years ago. And I've been a patient advocate since 2001 with different organizations. I'm currently president of the Italian Pulmonary Hypertension and Secretary General of the Alliance for Pulmonary Hypertension. So today my pep talk will cover what a business plan is, why having one is important, and how to write one. And I'm also going to provide a practical fictional example. So when we first discussed the topic with the members of the Alliance, I thought, well, is this actually going to be useful? Because I'm sure most associations already have a business plan. But it turned out that even in our discussions, France didn't have one, even the association I work for doesn't have one, and others too. So I hope you'll find this useful. I've really tried to make it as easy as possible to show you that it's not a big deal and it's something that anybody can do. So first of all, what is a business plan? It's basically a document which describes what you are as an organization, what services you provide to patients, families, and the community, what your aims are and objectives, how you're planning to get there, and what resources you need, meaning funding. So why is it important to have a business plan? There are several reasons. I've listed a few here. The first one being clarity of purpose, because having a business plan helps your association define clear roles and goals and the path to achieve them. It gives you authoritativeness with stakeholders. It establishes your association as credible and organized in the field. It's information that is very shareable because it's in an easy format and an easy way to communicate your mission and activities to outside people. It enhances funding applications because it demonstrates planning and organization. And finally, it enables you to track success and growth over the years. Coming now to the how to do it. Okay, it's really easy. Create a Word document that you can then convert into a PDF. It really doesn't have to be long. A couple of pages are enough, and details can be provided later at a conference call or at a meeting. There are lots of free templates on internet, and if you can't find one or don't know where to look, ask another patient association. No need to reinvent the wheel, as the saying goes. So I thought it would be useful to really get the message across that it's easy to do. To give you a fictional example, so I've created this new association in Italy called PH Italia. I'm Italian, as you may have gathered. So step one is to provide general information. So when was your association established? I've put some fictional dates and other information, of course, on this. Your mission statement. So what is your mission? Is it to provide support, education, advocacy, capacity building, whatever it is? Who is your target audience? Is your association targeted at patients, family members and caregivers, or also at healthcare professionals and other members of the PH community? What services do you provide? Phone helplines, virtual support meetings, information sharing through Facebook or other social media, leaflets? What are your goals? For example, it could be to improve visibility and offer additional services to patients and families. And are you a member of a larger organization? This is also important to mention in your business plan. In my fictional example, I've said that my PH Italia is a member of the Italian Rare Disease Organization, of PH Europe, and of the Alliance for PH. Step two is to discuss the governance structure. This is very important, especially for authoritativeness and credibility. So what is the legal framework? You should be a non-profit association, ideally, and in our case, it's registered. In this fictional case, it's registered with the Italian authorities. Then have a list of your board members. I've put some fictional names here with a little bit of a story about each one: a patient, former accountant, caregiver, community health worker, whatever. Do you have any volunteers that work for you? I've put the example of a guy who might do IT support or maintains your social media pages. What is your income? Presumably it's going to be membership fees, but also you might be involved in fundraising events or benefit from industry grants, or even, as in some countries like Italy, for example, and Hungary, even benefit from government support. In Italy, citizens are allowed to donate a part of their income tax to an association of their choice. And I know it's the same in Hungary. And what your main expenses are. So administration, IT support, printing of leaflets. You may have staff as well. This is the place where you indicate that. Step 3 is really about describing what your funding needs are. So what are your projects? For example, in my fictional example, a basic website. And what should this basic website contain? Information about the association, about pH, resources, and links. And you put an estimated cost. The same for educational materials. What does it cost to develop, translate, and print? And you might want to be organizing an annual patient meeting. Calculate the cost for venue, refreshments, and materials to distribute. Now, you're probably going to have some core costs in your association. What you can do is either list them separately or include them as a part of your project cost because they go into project management. You would have to specify that. So actually, your business plan is done, and it's only 1.5 pages, and this is what it looks like. I actually made one for this fictional association. So you see, it's very easy. All you have to do is put together the information that I've listed in my 3 steps and add always your statutes and your last financial report, and of course, your contact information. There may be other reporting documents that you're required to produce in your specific country. For example, an annual activity report, which is basically a summary of year's activities. It's generally not mandatory, but it's valuable for transparency. An annual social report. This is compulsory in some countries, for example, in Italy, and it focuses more on what difference we made versus what activities you conducted. And then a policy plan. This is required in some countries. For example, our Dutch member of the board said that this is compulsory in her country for tax exemption. And this policy plan outlines strategies, activities, and fund management. So check the requirements in your country, as these documents may be necessary for legal compliance, for maintaining charitable status, and even for applying for certain grants. So I hope this has been useful. And I've written quite a few business plans in my 22 years of patient advocacy. I'm very happy to give some more tips and advice. This was a very, very simple example. You can build on it and add a lot more, of course, but happy to help. Thank you very much for your kind attention.